Hello, I'm Catherine. Today we're going to be talking about back pain in the specialist area of general practice. So let's see what you already know with a few questions. So which of these is not a red flag for back pain? There's options for you there. And if you're struggling, it might be helpful to consider the serious pathologies that could cause back pain and think about how they might present. So I'll give you a few seconds for that. Okay. So the answer to this is unilateral radiation to the leg, which is not a red flag for back pain. So let's break this down a little. So a history of malignancy is important to consider because back pain could be caused by something like a spinal metastases. Trauma could be a cause of back pain, which could be due to a vertebral fracture. Thoracic pain is not something you normally see. Back pain is normally in the cervical or the lumbar region. So that will be a bit of a red flag for you. The unilateral radiation to the leg should really be bilateral leg radiation, which would be a risk factor. So that would be something like cauda equina syndrome. Okay, next question. Which of the following is the most effective treatment for back pain? So some options for you there. And the answer to this is something that's very frequently recommended to patients. Okay. Physical exercise is the answer to this. So all of the options should be used to facilitate physical exercise. The physical exercise itself is what will be getting patients back up on their feet. So the last question. What is osteoporosis? This is a bit of a tricky one. Let's have a little think about the pathophysiology. Okay, the answer to this one is D. So osteoporosis is brittle bones due to loss of tissue. This is because the bone formation is reduced in comparison to the bone removal. So A is osteopenia, which is a precursor to osteoporosis. B is osteomalacia or rickets. This can be due to low calcium levels, low phosphate, or low vitamin D. And C is osteomyelitis, which is caused by things like infection. So this is just a little breakdown. So we've started with an introduction. So we're going to talk about what back pain is, symptoms, risk factors, and a history you might expect to see, any investigations and differentials you want to consider, management within the community, some clinical exam and some OSCE tips, and then we'll finish with a summary and some MCQs. So we'll start by asking, what is back pain? So it's an extremely common presentation in a GP surgery. It has a wide range of social and psychological issues associated with it. As I mentioned before, it typically occurs in the cervical and lumbar spine. So again, if you see something in the thoracic spine, you should be concerned. So causes of back pain, there's quite a few. I've listed a few here for you. So some symptoms that you want to take from a back pain history. So they're very different when you consider different pathologies. And so taking a thorough history can be useful in formulating your differentials. So as mentioned, there's various presentations, and here's some descriptions for you here. One very important thing to consider is that a burning pain will always be neuropathic. And pain that seems to appear within the back does not always originate in the back. So it could be referred from the GI system, the cardiovascular system, and the rest system. So there, as I've mentioned. So some risk factors. So age, again, wear and tear of bones. Lack of exercise, this is mainly because the muscles aren't being used properly, so they're developing a bit more weakness, so they're not as strong. Obesity, you'll be carrying some extra strain. And poor lifting technique, which you see quite a lot in some occupational situations. And smoking is very, very important. This is because smoking can reduce blood flow to the spinal column, and this promotes slow healing of any disease that might be going on. So within the history, you want to ask certain things such as Socrates, so breaking down the pain, so where it is, what it feels like. Again, this is very important to discern the different pathologies. Any previous trauma or surgery, any associated symptoms, so if it's a more systemic situation potentially, any other conditions that they might have that could be sort of a link to a condition such as a rheumatological one. You want to ask how they're currently treating their pain, so things like use of NSAIDs, which could be also risk factors for other conditions. Think about if they're doing any heavy physical work, so asking about their occupation and any hobbies. What's very important with back pain is you want to consider how it's affecting that patient, because it's very, very individual and has a lot of psychological and social problems associated with it. And again, you always want to ask about those red flags. So what are the red flags? So the main thing you want to rule out is cauda-equina syndrome. This is a diagnosis you do not want to miss. So it can present in various ways, sort of incontinence of the bladder or the bowels, your classic saddle anesthesia, and bilateral neural deficit within the legs. So cauda-equina is at the end of the spinal column, so compression across that will cause these kind of symptoms. This is a neurological emergency. So other red flags include sexual dysfunction, any nocturnal pain, systemic upset. Again, this can be something more serious, things like spinal metastases, thoracic pain, as we've mentioned, an abnormal gait, a history of cancer, and trauma as well. Okay, so there's various investigations you might want to consider. The very first one that you should always start with is the Start Back screening tool. Now, this is very helpful in assessing the patient's physical and psychological impact from their back pain. And you can ask them these certain questions that I've displayed on the side here to get certain points from that, and the result of this is you can sort of get an idea of their response to physiotherapy, so how likely they are to benefit from it. So from then you can refer them to the MSK service. There are various imaging techniques you can use, but they are not routinely done. They should be chosen dependent on your suspicion of any pathology, any presence of any red flags. So X-rays, MRIs and CTs. You can look for any spinal stenosis, any kind of fractures. Blood tests, you can look for ankylosing spondylitis via presence of HLA-B27, for example. DEXA scans as well. Nerve studies look for any impingement. So what are your differentials? So again, cauda-equina syndrome, you do not want to miss that. We'll consider intervertebral disc herniation. So the most common sites for this is the L4, L5 disc, the L5, S1 disc within the lumbar region, and then within the cervical region, C5, C6 disc, and the C6, C7 disc. So these herniations can cause compression of the spinal nerve, exiting the spinal column, and cause related symptoms to that specific spinal nerve. Consider spinal fractures, especially when trauma is present. Cancer, spondyloarthritis, this is just an umbrella term for inflammatory diseases that affect the joints. So the most common of this being ankylosing spondylitis, which is seen within sort of childhood, young adulthood. So ankylosing spondylitis presents with this sort of fusion of the bone, this classic bamboo spine appearance on an X-ray. Another one is osteoporosis, especially within more elderly populations. So how do you manage them? This is very different to the different patients, partly because of their different pathologies that they might have, and also because of the psychological impact that we talked about before. So the most important thing with back pain is educating the patient appropriately. So encouraging them to move is the best thing you can do for them, as we talked about before within the starting questions. So movement is the best thing. And things like pain medications can be used to facilitate this. So along with use of pain medication, you need to consider long-term opioid use, which is not really recommended. Use of NSAIDs, as we touched on before, can lean onto other pathologies, so it can increase risk of ulceration within the gastric system, for example. Consider things like muscle relaxants if there are spasms that are there. As we've touched on, the psychological side can cause a lot of depression, anxiety within patients, so antidepressants might be necessary. Things like injections into any sort of joints, and surgery might be necessary for these patients. Alternative medicines are also something that might be quite beneficial for them. So things like acupuncture, massage, yoga can give a patient a lot of benefit. So in your clinical examination, what are you looking for? So you want to examine the spine itself. So when the patient comes into the room, you can look at their gait, look at the curves of the spine, kyphosis, lordosis, any scoliosis that might be there. Palpating the spine's processes, look for any tenderness, looking at the range of movement within the spine. Remembering, when you're asking them to move and look at this range of movement, this is always done passively. You do not bend their spine for them. So you could do Schuber's test. So what you do with this one is you look at the dimples of Venus in their lower back, asking them, seeing the movement of that as they bend forward, to look at the range of movement within the lumbar region. So this is produced in ankylosing spondylitis. You could also do a straight leg raise. With this, you're lying them on their back, asking them to raise their legs up. From this, you can look for any sciatic pain, which can be seen if the sacral nerves are being irritated, if there's any disc prolapse, particularly within the L5-S1 area. You could also do a femoral nerve stretch test. So you can lie the patient prone on their front, flex their knee and try and extend their hip up. So this test is positive if they get pain within their thigh inguinal region. You could also do a full neurological examination. So some tips for the OSCE. One of the most important things is showing empathy for the patient. So as we've already mentioned, back pain is very individual to that person and can affect them in very different ways. So asking them about, their lifestyle, showing that you care and want to get to the bottom of why it's affecting them and how it's affecting them is a very, very good thing to do. So as I've touched on already, beginning any examination you're doing by looking at the gait as they come into the room, so starting that exam as they come in. When performing an examination, they should be done with the patient in their underwear, so you can see all their muscle alignment, spine properly, and especially with their hips as well. As a rule of thumb, it's very helpful to inspect the joint above and below any area of complaint. So within the back, it's the entire spine. So you might want to have a look at the shoulders as well and the hips, because these joints could be the origin of any back pain. So they should always be looked at. So in summary, I'm going to go over these questions I went through at the start, see what you've learnt. So the first question, which of these is not a red flag for back pain? Okay, the answer to this, unilateral radiation to the leg. Again, that should be bilateral, looking at quarter recliner. So the second question, which of the following is the most effective treatment for back pain? Okay, we've talked about this a lot. Physical exercise is always the best thing to do. And the final question, what is osteoporosis? Okay, and the answer to this one is brittle bones due to loss of tissue. So I've included some resources here for you to look at. So the nice guidance of how back pain is treated, a link to the START screening tool we talked about, and a link to the Arthritis Foundation where you can learn more about what arthritis is and how it affects patients' lives. So thank you for listening.